Hey, welcome to the open enrollment for Cayce Meal Supply for 2023. Today, we're going to talk about the medical plan, dental and vision, life insurance offered to Cayce Meal Supply. Very minimal changes for 2023. The plan, the medical benefit itself, no changes in the plan or the provider. There is a slight increase in cost from a payroll deduction standpoint. They will still offer one plan at zero cost for the employee only. The mid-tier plan is going up about $1.19 for payroll, and then the platinum plan, the best plan offered, is going up about $2.16. So very, very minimal cost increase for the employees, and then that's after first increase we've had at all on deductions for quite some time. So dental will cover that same plan. There is a small increase on that cost as well, about 89 cents for employee only coverage. So very minimal increase at all. No changes on vision or life insurance. And the enrollment process itself is basically open Wednesday, December 21st through Wednesday, 12/28. So you'll have a week to look at everything and make changes if needed. Again, it is a passive enrollment. So what that means is if you're happy with your benefits, it can just roll over. No need to make any changes and go from there. So kind of dive right into the medical benefit. One thing to keep in mind is your plan year runs January through December. So your deductible is going to reset January 1. Your out-of-pocket is going to reset January 1 and straight down the line. So just keep that in mind. This year, we're staying with Meritain and using the Aetna network, so no changes there. As a reminder, inside your all's program, Cayce Meal offers some cost-saving initiatives. Smith RX is our pharmacy benefit manager. We'll talk a little bit about what they can do for you. We have a KISS card, which is for outpatient surgeries and diagnostic type care. There's an opportunity to waive your deductible there. We'll talk a little bit about that. And then if you happen to be diagnosed or your family members happen to be diagnosed with a cancer situation, there is a value-added program that is available to you on that as well. So the pharmacy benefit, as I mentioned, is through Smith RX. They have a program called Smith RX Connect, and their whole role is to help you find the prescriptions you need at the most affordable cost. They have patient assistance programs out there, copay coupon maximization. That is, if you qualify for a copay assistance program, they're going to get that plugged in for you. And then also international sourcing. Can we find your drug a little less expensive and have it shipped to your home from the international market? Those are all opportunities to save you money and still get your prescriptions at the best cost possible. How to find out about prescription qualifies. If you have something going on with your prescriptions, you can contact your member support at the number listed there, 844-385-7612. Throughout the last year, Smith RX has been a great partner for Cayce Meal Supply. We've had several instances where they've been able to help employees save money and get their prescriptions delivered to them at a little bit lower cost. So please reach out if you have any issues at all with prescriptions. We talked about the 3D programs they have, which is the patient assistance program, the copay coupon maximization program, and then international sourcing. All three of those can not only help you lower your costs, but can also help Cayce Meal Supply control the cost of the health plan to their members. So it's very important pieces there. Won't go into a lot of details there, but if you have questions, reach out to the Smith RX folks. Also included in your plan is a KISS X card, and this is keeping surgery simple. Basically what they do is they're offering you bundled pricing for any of your outpatient surgery type needs, about 400 procedures covered. If you go through the KISS X program, then they will waive your deductible and your out-of-pocket expenses out there. So it's an incentive for you. So if you're on any three of the medical plans, you could potentially have your deductible waived. And the average care is about 15 to 60 miles. We have added a orthopedic center in the Clarksville area for your employees. We had a few instances last year where orthopedic services were needed, and there wasn't a close location that made it make sense to use the KISS X program. So we have added that to the program this year, and that's based out of Clarksville as well. How that program works, basically if you have some type of procedure scheduling or your doctor's facilitating that or diagnosing that, then you just call the number, the KISS-X number. They'll work out and find your facility that is, highly rated quality scores. That they give us a bundle price, so you know your price is what it is going in. And again, if you use this program and go to where they send you, that they're going to waive your deductible out of pocket, which is really important. Pretty good cost savings for you all. And most importantly, you need to know that they're looking at high quality centers, people that do these type of procedures quite often, and so your risk of infection, your risk of re-injury or going back in for the same procedure is pretty low. So it's not only the lowest cost, but it's also high quality piece out there. So pretty simple way to look at that. And then diving into your health plans themselves, again, we'll offer 3 different health plans. We'll start with the most expensive one, which is on your screen now. That's the Platinum plan. That gives you a $1,000 deductible for individuals, a calendar year maximum out of pocket of $2,500, and then it's 80-20 coverage between. So once you meet your deductible, you would pay 20%, and the health plan would pay 80% of that cost for you. That plan does come with co-payment, so you've got a $20 office visit, $30 for specialist. Emergency room co-payment is $250. Urgent care is $100, and then you also have the prescription drug co-payments of $10, $30, and $50 under that plan. So that is the Platinum plan. Pretty rich benefited plan, really good coverage for you and your family there. Next, we'll have the Gold plan, a little bit higher deductible. It is a $3,000 deductible, a little bit higher, quite a bit higher out of pocket, $6,500 out of pocket, and the same 80-20 coverage in between. So you pay 20% between your $3,000 and $6,500 out there. So little less expensive out of your paycheck, but a little bit more responsibility if you incur those deductible expenses. For the everyday things, this plan also offers those co-payments. So this one has a $25 office visit co-payment and a $50 specialist, $250 emergency room, and $100 urgent care. The same prescription drug coverage, $10, $30, and $50, $10 generic, $30 for preferred brand, and $50 for non-preferred brand there. And then the third plan we offer is called the Silver plan. Works very much the same way. It's just a little bit higher deductible, $5,000 deductible, $6,500 out of pocket, and it's got a 70-30 window of co-insurance where you would pay 30% and the plan would pay 70%. Has the same co-payment structure as the other 2 plans. So if all you did was have an office visit and prescription, you would pay those co-payments going in, and you wouldn't have to worry about meeting your deductible out there for you. So obviously a wide range of plans for you to choose from. And we'll talk about the contribution piece here as well. As always, the Silver plan, which is the $5,000 deductible plan, that is 0 cost for employee-only coverage out there. And Gold plan, which is at $3,000 deductible, right in the middle, that cost is $24.94 a pay period for employee-only. And then in the Platinum plan, the best plan that Cayce offers is $45.29 per pay period on that. Just to kind of give you a ballpark on that, the Platinum plan is actually going up $2.16 a paycheck for the employee only. The Gold plan is going up $1.19 per paycheck, and then the Silver plan is 0 cost. So very minimal cost increase passed along to the employees this year, but do notice that. And then obviously if you have employee spouse, employee children, or family coverage, look at the cost difference there. Again, very minimal, but there is some cost increases there for you, okay? The dental program is staying the same. The plan is exactly the same, no deductible. Each person has a $1,500 annual benefit. Preventive services covered at 100%, so you get your 2 cleanings and 1 set x-rays a year at no cost to you. Minor services and major services is covered at 50%, up to that $1,500 max. And then it does have child orthodontic benefit up there, up to $1,500 there. Again, that's through Delta Dental. And so no changes there. A little bit of a cost increase. The employee only is going to $9.18 a paycheck. And again, that's up about 89 cents paycheck versus what you're currently paying. Employer plus one is $22.72, and then family coverage is $37.35 per paycheck for you. Vision plan, again, no changes there. That is through VSP Vision, through Delta Dental. That plan gets you an annual eye exam for $10 copayment once a year. Your materials copayment is $25. The contact lenses, you can get up to $130 allowance once a year for your contacts. Lenses for your glasses, you pay a $25 copayment, and that's going to cover the basic lenses there. And obviously, if you add some value, add features in there, transition lenses, scratch resistant, glare resistant, those kind of things, you will pay a little bit more for those. Your frames, you pay $25, and that's going to get you a pair of frames up to $130 allowance, and that's every 2 years, every 24 months there. The cost under that plan remains the same. It's $2.91 per paycheck, up to $9.95 for family coverage as well. The life insurance piece, Cayce Mill supplies life insurance at no cost to you. The management employees have a $50K benefit, and the hourly employees have a $25K benefit. And that also does include accidental death and dismemberment out there. And this is always a good time of year to remember to update your beneficiary within the Employee Navigator system when you log in, if you need to make changes on that. Voluntary life, you can buy additional life insurance on top of what Cayce Mill provides for you. This comes in $10,000 increments, and you can cover up to 5 times your salary or $300,000, whichever comes first. For a new employee at Cayce Mill, you can get up to $110,000 of guarantee issue, meaning no medical questions asked when you're a new employee to Cayce Mill Supply. You can take that coverage of $110 with no medical questions asked. Spouses can be covered up to 50% of what you take out. And then there's a $25,000 GI on the spouses as well for new employees. And then you can also cover your children at up to $10,000 per child. You pay one low rate regardless of how many children you have under that plan. Rate examples here on the bottom. You could have a 32-year-old employee for $110K. That would cost you about $508 per paycheck. So very affordable coverage. And then obviously, as you get older, it gets a little bit costlier. 49-year-old taking out $50K in coverage would be about $5.31 per pay. Keep in mind that does go up every 5-year increment as you get a little bit older for you. Additionally, Cayce Mill also provides Aflac as some supplemental pieces. Again, all of these are voluntary. If you choose to pick one out, then you would pay the cost of that. The first one is hospital indemnity. So if you're worried about paying your deductible, if I go in the hospital, that plan will pay you up to $500 per year per person towards that. And again, that money comes to you. You decide how to spend that. The next one is their accident plan. So anything related to accident, this plan will pay you money back. A good policy to have if your kids are playing sports, if you're fairly active, whatever the case may be. You can see the weekly rates there from that standpoint. Next one is a critical illness policy. This is a policy that covers a heart attack, stroke, end-stage renal, which is kidney failure, paralysis, organ transplant, coma, and right down the line. You pick a lump sum benefit of either $10,000 coverage. Spouses can be covered at half of that, and then children are covered no cost as well. Your rate is based upon your age. What's most important about that policy is that if you take it, you lock in that rate at your age whenever you take out the policy, so it does not increase on you. And finally, the cancer coverage with Aflac, which is probably their most popular product. Again, we all know how expensive cancer care can be. This provides you money if you're diagnosed with cancer. There's an initial diagnosis benefit, and then as you go through treatment, there's different benefits available to pay out, help you absorb some of that high cost of cancer treatment. And obviously, if you miss work, if you or a family member is going through cancer care, then that's to provide offset some of that cost. So 2 different policies to choose from there on the cancer plan as well. So the enrollment process, is a passive enrollment. That means employees will roll over to the current plan if you do nothing. So your coverage will remain exactly the same. The new deduction will go into place in January. If you need to make changes, you need to take somebody off the plan, add somebody to the plan, or you need to add dental or vision or take it off, whatever, then you do need to log into Employee Navigator. Attached with the email from Candy is instructions on how to do that. If you can't remember, pretty easy system to navigate there. And obviously you can always call Candy for help, or our office as well. Keep in mind, during open enrollment, this is your time of year to make changes. Once open enrollment is over with, then you can no longer make changes unless you have a qualifying event. That's birth, adoption, marriage. Maybe your spouse loses their job and they need to make changes, come onto the plan. Then that's called a qualifying event, and there opens up a small open enrollment window of 30 days to make those changes. And then the one thing I will add, if you need to make any changes with Aflac, then you need to call Stephen Hill. His number is listed there, and it's in the benefit guide as well. 270-791-5431, or you can email him at the address on the screen. So if you need to make any changes with Aflac, or you just want to know what do I have, then you can just reach out to Stephen, and he'll be glad to take care of you on that. Also, as a reminder, on any of the Aflac pieces, there's usually a wellness benefit. So if you've had a cancer screening, you've had a mammogram for the ladies, you've had routine annual physicals, if you have one of those Aflac policies, they typically have a wellness benefit. So you may could get the money back from that policy by filing that claim. Stevie can help you with that as well. As I mentioned, if you need to make changes, log into Employee Navigator. The instructions are attached. Obviously, you can see Candy for assistance. Whatever changes you make and those slight changes on the medical costs and the dental costs will go into effect the first paycheck in January for you. That open enrollment window is Wednesday, December 21st through the end of day, Wednesday, 12/28. So we've got you through the holiday to take a look at it and make changes if needed out there. Also attached to this email, and you can print out, is the benefit guide. That is in there, kind of list everything we went over. That is available for you to print out and to have with you if needed as well. So hopefully that answers all of your questions. And obviously, if you don't, in your benefit guide, if you have any questions that we need to answer for you, on the back page of that benefit guide is all of our numbers, which is Housing Insurance Group. You can reach out to us directly if there's something that you need help with, or you just need help getting in the system. Please feel free to do that. With that, that's all we have for this year's open enrollment.